brain is responsible for lots of important computations in our body, as well as our behavior. Therefore, when a population of cells in the brain stop working as they're supposed to, they can cause debilitating disease like Parkinson's disease or even sometimes psychological disorders. Traditionally, these conditions were treated by medication. The problem with medication is that its effect is not localized, which means that they're going to affect both malfunctioning and healthy cells altogether. As a result, they're going to solve some problems, but they tend to generate new complications for the patient. So scientists have started to look for more localized methods. Deep brain stimulation is one of these methods. As you can see in the picture in the left, the way that is carried out right now is that they're poking a couple of electrodes deep into the brain of the patient and then electrically stimulate that area. As gory as it might look like, it turned out to be a very successful method, especially for movement disorders, thanks to its localized effect. However, since this method is very invasive, it can't be used for less severe brain conditions because of the complications that might come up with the surgery. So my thesis starts here. We're trying to introduce a non-invasive method for deep brain stimulation so that more patients can be benefited from. In our method, we're going to use light for stimulation of the brain cells. Such techniques already exist, but they only work with visible light, and visible light cannot reach deep into the brain from the top of the skull. However, there is this light, the near-infrared light, the same that your remote control is using to signal the TV or other stuff, and it actually can reach deep into the brain. So what they propose is to make an injectable micro device that can absorb this near-infrared light deep into the brain and transform it to the visible light there, and then change the behavior of the cell around it. There already exists a type of nanoparticle that can do this transformation for us, but the problem with them is that their efficiency is very low, and as a result, they are very limited to be used for long-term deep brain stimulation. To increase the efficiency of these nanoparticles, we're going to put them in a nanostructure on a conductive microdisc so that it increases its light intensity, and we are expecting that it's going to increase the efficiency to about tenfold. We hope by introducing this technology, we can pave the way for non-invasive deep brain stimulation so that the 2-year-old, like the patient on the left, doesn't need to go through such an invasive surgery to be treated for his brain condition.